Okay, so this is chapter 2 in your Med-Surg nursing book on health equity and culturally competent care. Health status is basically the status of the health of a person, or it can even mean a community. There's some communities that are not healthy, and that could be things like lack of parks for children to play, lack of doctor's offices, lack of resources for even a place to get fruits and vegetables. I know that when I was in nursing school, we did what we called windshield surveys, where we would drive around a specific neighborhood or community, and we would look, okay, if they want to eat fruits and vegetables, where can they get it? And we would find that there's no grocery stores, that there's nothing but fast food restaurants in that area. Well, if you don't have transportation, how are you supposed to get fruits and vegetables? So that is something, one of the things that contributes to the health of a community. A health of a person, well, that's what we look at a lot as nurses, is their current health problems, but we also have to look at their coping um, mechanisms, their coping resources, their social support, and do they have family? Do they have financial barriers? The Affordable Care Act was brought about. There's many, 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 many different components of it, but most people tend to think of only a few, and one of them is, oh, I have to have health insurance. Well, that's a whole nother class, is all the talking about universal health care, but you know, this country is very lacking in that, and um, it's the first step. We've got many more steps to take to make this better, but it's a first step. The first year that the Affordable Care Act was introduced, it reduced the number of uninsured Americans by 5.4 million. Millions of people still do not have insurance, which is also contributes not only to their individual health but also their community health. Health disparities. That's the differences in the actual definition: incidence, prevalence, mortality, and burden of diseases that exist among specific population groups. So, a health disparity is more of a difference, let's say, of a person that has a job with wonderful health insurance versus a homeless person that has no insurance. That's a disparity. It should be as equal as possible. That's where we come into the health equity. Every person has the same opportunities. No one has a better potential than someone else. Think about, like, if someone had cancer. You've got the person over here with the wonderful health insurance, and it's going to pay for their chemotherapy. Now you have the homeless person who has no insurance, probably would have to get help getting on like Medicaid. Medicaid is for people of a lower income status. Medicare is for older adults, people over 65 and older. Medicaid is for lower income. But Medicaid is not going to pay for things that this nice, wonderful private health insurance is going to pay for. So now this person that doesn't have insurance or has Medicaid or a very minimal insurance policy, they're not going to have access to the same medications that the person that has the better insurance is going to, and most likely they will die, whereas the other person will have a chance to live. That's 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 not right, and that is what health equity is all about: is making sure everybody has the same opportunities. Different things that lead to that place, depending upon where you live. There may be a rural area, may not have access to the latest, the best, may not have a hospital, whereas if you live in a um, somewhere a very metropolitan area, you're going to have more access to health care. Your income, we talked about that. Health literacy, you may not have the knowledge, may not understand, may not know. Um, Seeing patients, I had a patient came in that his labs, his A1C, and I know this is all new to y'all, but A1C is a average of basically what someone's blood sugar is doing for 3 months. So you can look at somebody's blood sugar like at a time and place when you do their check their blood glucose, but an A1C does labs to checks does pretty much like a 3 month average. You want people to be in the 5% range. We start hitting up high fives, low six. That's considered pre-diabetes. 6.5 is considered diabetic. If somebody is up around 10 or higher, I've seen people, 15%. We had a man that came in with 10%. It was like 10.2 A1C, which means he is diabetic and it's severely out of control. It's just ragingly out of control. But he just shrugged his shoulders and was like, so? Well, he didn't realize all of the damages that diabetes can do to your body. And I had to then educate him because he said, I'm not going to take any medicine. I'm certainly not going to inject myself. And I had to spend some time educating him to let him know that things had to change or he was not going to live very long. So health literacy, he just didn't know. Gender and age. Gender, males tend to have a lot of issues that females don't, but well, never mind. So it depends on the issue because some issues women have more than men. So it depends upon the situation. Sexual orientation. The transgender, they are definitely not treated in an equitable situation. Um, Let me see what else. Do, do, do. Yeah, especially I was trying to look at my notes here. Even discrimination against the LGBT population, they have a high rate of psychiatric disorders, a lot of substance abuse and suicide due to these discrimination acts. Um, some things that lead to this disparity could be stereotyping. Stereotyping, y'all know what that is, right? That's where you look at a particular culture or race or ethnic group and just think that they're all the same, and you just develop your beliefs based upon that. Prejudice. Unfortunately, we have prejudice in our society. Discrimination, bias. So culture is basically knowledge, values, beliefs of a certain, people have different cultures, um, different ways that they grew up with. It's a way of life. And I'm sure everybody here probably has something in their family or something in their culture that is just the way things are done in your household or family, but someone else may not experience the same. Part of nursing, when I started nursing, we had to take sociology as a course, and it was very enlightening because one of the things that we learned was there's no such word as normal. Um, yeah, I know in healthcare we have, oh, that's a normal blood pressure or something like that, but as far as people itself, cultures, there is no normal in culture. It's normal is to you what you do, but it may not be um, what's what's considered normal for someone else. This is something that I I have conversations with my mother about. Now, granted, she's 93, almost 94 years old, so she's of a different different culture, different generation. But she'll say something like, "Oh, that person, they're just not normal." And always get her with this. I'm always like, well, define normal. And it's funny because she always looks at me with this funny look, and I'm like, what's normal? You said they're not normal. What's normal? And she says, well, like like me. And I'm like, well, that's who's to say you're normal? Um, so really had to have a lot of talks with her. I said, people that, let's say you go out into the rainforest and the indigenous populations there that have never, they've never even seen a cell phone or they live off of, they hunt for their food. If you pick them up and dump them here in the middle of our society and they see everybody walking around with their, noses stuck to this little black box in their hands, they would think we were nuts. We're not normal. So again, normal is, it's relative. There is no normal. That's where the cultural competence comes in. That's when you start opening your mind to different cultures, have different beliefs and different ways of doing things, and that's fine. That's normal to them. Where you're abnormal. That is cultural competence when you start opening your mind and seeing that and understanding that. It references you here to a figure, a table in your book. That table is on page 21. Talks about basic characteristics of culture, dynamic and ever changing, not always shared by all members of a cultural group, adapted to specific conditions such as environmental factors, learn through oral and written histories as well as socialization. You learn your culture. Acculturation. Does anybody know what that means? Obviously, you know what it means because the definition is right here on the slide. Um, it's a lifelong process of incorporating cultural aspects of the context in which a person grows, lives, works, and ages. So acculturation, it's bidirectional. Basically, um, let's look at Miami and Little Havana. That's the people, the Cubans. They came over, they migrated to the United States, and they have Little Havana, where they they still have their culture. Their Cuban culture is dominant, where rather than um, assimilating into our culture. That would mean they start leaving behind their Cuban um, their Cuban culture behind and start becoming more of an American. Um, so a lot of times they talk about that about like assimilation and acculturation. We talked about this already, didn't we? Stereotyping, ethnocentrism, that is the belief that your own culture is superior. That's when being ethnocentric, that means you think your way is superior, you're better. Well, well, they're not normal. That's, would be kind of a thing, is when you think that you're normal because of your culture, which not necessarily. This is where we talk about the cultural competence again, where that's when you start understanding, appreciating, see other cultures. And and it's really interesting to learn about other cultures. We'll do this in class. We'll discuss the different cultures in our class because I guarantee you we will have a wide variety, and it's very interesting to learn. And this is where you get culturally competent when you hear, you understand, you learn. I find it fascinating. So, cultural diversity in healthcare, you are going to run into all different types of people, different cultures, and you have to be very aware of it. You have to understand it, and you have to accommodate to the best of your ability. Meaning, if they're of a culture that doesn't eat um, pork or doesn't eat beef, then you need to be aware of that and you need to be in a position to help them make choices from the menu um, of the hospital diet um, that will be within their cultural diet. I've had even patients that had family members bring in food and they didn't eat any hospital food because it was completely food against their culture. Um, Now that's a kind of a fine line there because okay, that's great. And let your family bring in your food that you eat of your culture. Um, but make sure that that diet is within the prescribed diet that the physician has ordered. I mean, if they're on a low sodium diet and then the family's bringing in food that may not match what the physician has ordered. So that's a fine line where you got to be culturally competent, but also you got to watch out for, make sure that they're doing what they need to be for their health. Um, Different toxins, even like different cultures have like folk healers. They have different traditions. Um, it kind of talks about like shamans and things like that. So, you might have that where you may have a patient that brings in suddenly their traditional healer of their culture. May have a shaman from like a Native American person may have, or Asian Americans. A lot of times will bring in like the uh, herbal therapist. So again, it's something that you need to be aware of. You need to be accommodate the best of your ability, but you also need to make sure that nothing is being done that's against what the physician has ordered, or at least make sure the physician is aware of it, and ensure that it's not something that is going to harm the patient. So, also you need to understand the roles of the family of the patient because there's some uh, certain cultures that look at um, the oldest male in the family is the leader of the family, and that is who all decisions, healthcare decisions, are made by. So it may be that um, the oldest male in the family, like the head of the family, the patriarch, um, any healthcare decisions are made by that person. And again, this is again a cultural thing, so you need to just be aware of it, understand it, and try to accommodate as best as possible. Um, Also, let's see, it may go into that even more. Let me see. Personal space. Ooh, that's a big one. Um, Depending upon your culture, it's funny because personal space is different for different cultures. Um, Typically, you have the different space zones. You can see here, you've got intimate, personal, social, and public. Social distance, keeping your social distance 4 to 12 feet. We all heard about that with COVID, didn't we? Socially distance yourself. Well, this is the official uh, shows official social distance, what it means. So personal, and again, I guarantee you, in our classroom, different people will have different ideas of this. Have you ever, well, I'm an introvert, and so I tend to kind of be more of a little bit step back kind of person, and maybe my culture has me a little bit further back where my call it my bubble. It's, I got my personal bubble around me. Don't get in my bubble. I even would tell my kids that when they're little. They're all up in my face. You're in my bubble. Get out of my bubble. Have you ever been like talking to somebody and then they step in real close where their face is just inches from yours? And I mean, for me, I step back and then they step forward again and get back in your bubble. And that's a cultural thing. And it kind of cracks me up because you can kind of, see what people's different personal space levels are and what they're comfortable with. Again, touch, we talked about that earlier with another slideshow was talking about how different cultures, some people like the therapeutic touch, some people don't want to be touched. Food, nutrition. Um, We talked about that as well. Different immigrants have issues because they may be have just come from a pretty traumatic area. Look at Ukraine right now. Look at maybe some immigrants from Ukraine. They're shell shocked. They've been uprooted from their home, probably leaving everything behind. You need to be aware of that. You need to understand that it's causing them a lot of stress, a lot of mental distress, and just be aware culturally. You don't know. There's also medications, and you know what? Some medications work better with different ethnic groups than others. So, and then some people have different side effects than others. Um, Also, be aware some people use like different cultural remedies and prescription drugs. Um, and just understand that, people have their preferences on that. I mean, even just like, even vegans, they're going to be very aware of what's even in a medication. Is there any animal products in it? Maybe, maybe not. I don't know. Some insulin, it's pretty synthetic now, but it used to come from pigs. So I'm sure, a diabetic would be like, oh no, that's coming from a pig. I'm not using that. Um, as far as medications working, some medications, you'll learn that more in pharmacology, about different medications working better for different populations. So self-assessment, you know, look at yourself. Look at your culture. Look at anything. We'll talk about this in class. We'll ask again some of your own cultural um, differences. It talks about here also about in your book about using an interpreter if you don't speak the language. Communication is big in the hospital. A lot of times people come in speak a different language. We tend to turn to their family member. Um, and in some cases that's okay, but the proper thing to do, protocol is hospitals provide interpreter service, and it's really cool. It used to be we used to either call the interpreter would actually come to the hospital room and interpret. We used to have also these phones that had like two handsets where you would get an interpreter on the phone and then the patient would have a handset, you would have a handset, and whatever you said, the interpreter would translate to them. Yeah, that's old school. Apparently now they have these lovely little like video screens and they can wheel it into the patient's room and you actually have a video, like a video conference there. This is especially like with American Sign Language. This is awesome because you've got the person can do sign language right there. But that's what you would bring in. Trying to remember what it's called. Shoot, can't remember the name of it right now. But anyway, it's like a basically screen, or can even use like an iPad or something. But a lot of times it's even on wheels and they wheel it in. So you want to use the proper interpreter, hospital approved interpreter. Family members could maybe not tell the patient all of the information they need to. You have bad news for the patient. Oh, your test results show, you've got terminal cancer, and now this family member is freaking out, and they don't want to tell their mom because they're afraid she's going to get upset. So they don't tell her, and you don't know that because you don't speak the language. This is why you have to have the hospital approved interpreter. Now, our lovely phones have um, Google. I have no brain today. Google. It's like a what is it called? Google Interpreter. Google. It seems like it has a better name than that. I can't think of what it is. Google Translate, I think. Um, Google Translate. So this Google Translate is like the coolest thing in the world, um, because sometimes you don't want to have to bring in the whole iPad and get an interpreter involved if you've just got a simple little question. Do you want red jello, strawberry jello, or orange jello? I mean, why get an interpreter in for something like that? I mean, well, most of us, I think, well, I was going to say know the words, but maybe not for any language. But Google Translate, man, you just pull that up and you talk into it, and then you just select what language, and then it basically translates for you. This is amazing, unbelievably amazing. So I don't know what the hospital stance is on Google Translate. I would imagine something that's very basic question like, what flavor Jello. Can't see the hospital having an issue with that. But it is a nice handy little tool to have, rather than using the hospital approved interpreter. Um, Advocacy. So always be an advocate for your patient. If advocate, that means you are standing up for them. You are being their voice. Talks about reducing health disparities and increasing cultural competency. This is just a picture of somebody reading. Standardized guidelines. Always use basically, it's your evidence-based care guidelines to reduce disparities. Evidence-based, I don't think we've talked about that yet in this class. We will talk about it, but things with healthcare, not just nursing, but nursing, doctors, nurse practitioners. We use evidence-based. We don't just do things because, we think this is what's going to work. We look for evidence, and we'll definitely do some examples of that in class. All right, here's a question. Which patient would the nurse determine is at highest risk for untreated hypertension? So now we're going to health equity. Equity, right? Highest risk for untreated hypertension. A 46-year-old black male without health insurance. A 62-year-old Asian American female who is able to read. A 74-year-old upper middle class female who is not married. Or a 58-year-old white male as a high school education. Who do you think is the highest risk for untreated hypertension? Not just hypertension, untreated. All right, it's going to be A, the 46-year-old male without health insurance. Why do you think? Why do you think he's not getting treatment? He doesn't have health insurance, right? It's expensive to go to the doctor, so he's just not going to go get treatment. Another question, which intervention by a nurse would best help to reduce healthcare disparities? Which intervention, that's something you do by a nurse, would help reduce healthcare disparities? The nurse becomes fluent in the languages of the most common minority groups in the country. The nurse monitors differences in the prevalence of specific diseases in the population served. The nurse encourages persons from minority populations to choose careers in the healthcare profession. Or the nurse uses guidelines for the management of common diseases that are based on the patient's gender, age, and culture to help reduce healthcare disparities. What do you think there? Answer is going to be C. Nurse encourages persons from minority populations to choose careers in the health profession.